Have you ever felt that sinking feeling, desperately wanting to connect with a loved one, but the words just won't come? Or perhaps you're on the other side, trying to understand them, but their message feels trapped, just out of reach. This is the daily reality for millions of families touched by aphasia, a communication disorder that steals words but never steals intelligence. It can be frustrating, isolating, and deeply challenging for everyone involved. Welcome to CareWise Seniors, your trusted guide for navigating the golden years with health, dignity, and wisdom. Today, we're not just discussing a condition, we're exploring the art of connection. We're learning how to bridge the communication gap when aphasia enters your family's life. What it is and what it isn't. So, what exactly is aphasia? At its core, aphasia is a language disorder. It typically results from damage to the parts of the brain that control language, most commonly due to a stroke, but also from head injury, brain tumors, or progressive neurological diseases. It is absolutely crucial to understand what aphasia isn't. It is not a sign of reduced intelligence. A person with aphasia is just as smart, capable, and full of thoughts, memories, and feelings as they were before. Their ability to express those thoughts or understand incoming language is what's impacted. Imagine this for a moment. You know exactly what you want to say. You want to tell your daughter how much you love the flowers she brought, but your mouth simply won't form the words. Or maybe you say chair when you mean flowers. That is a glimpse into the world of aphasia. It's a constant battle between a clear mind and a locked tongue. Now let's explore the practical art of connection. We'll look at these as paired principles, a positive action to take and a pitfall to avoid. Principle number 1, the gift of time. Give them time and be patient. This is the single most important gift you can offer. People with aphasia need more time to process information and formulate their responses. A comfortable silence isn't empty. It's a space you are holding for them to find their way. Now consider the opposite. Don't interrupt or finish their sentences. While it comes from a place of wanting to help, this can feel like you're taking away their power. You've robbed them of the chance to achieve the victory of finding the word themselves. Remember, the goal is their expression, not your speed. Principle number 2, the path of clarity. Do simplify your language. Use short, direct sentences. Avoid jargon, metaphors, and abstract ideas. Instead of asking, would you prefer the chicken salad sandwich? Or are you in the mood for the vegetable soup? Keeping in mind we have leftovers? Try this. Hold up both options. Say chicken or soup. Wait for a point or a nod. And on the flip side, don't correct every mistake. If your loved one says spoon when they mean fork, but the context is clear, let it go. The goal is successful communication, not perfect grammar. Constant correction can be demoralizing and make them hesitant to even try. Celebrate the meaning that gets through, not the precision of the words. Let's pause for a moment from the practical tips and talk about the heart of this journey. It's important to acknowledge that when aphasia enters a family, there is a form of grief. It's the grief of lost conversations. It's the mourning for the ease and spontaneity you once shared. It is okay to feel this loss. But here is the profound truth. The wise lesson in this challenge: patience is no longer just a virtue, it becomes an active expression of love. The moments you spend waiting for a word are not empty time. They are moments filled with your unwavering presence, your respect, your love. You are sending the most powerful message of all. You are worth waiting for. Your voice matters. You are not losing communication. You are being invited to discover a new, deeper language together. A language spoken not just with the tongue, but with the eyes, the hands, and the heart. This is the journey from conversation to true communion. This journey requires us to always protect the dignity of the person we love. Principle number 3, the circle of respect. Don't talk about them in their presence. This is one of the most common and hurtful mistakes. They can often understand far more than they can express. Treating them as if they are invisible is deeply demeaning. Do maintain adult dignity and respect. Always speak directly to them, not about them. Use a normal, adult tone of voice. Include them in decisions. They are not a child. They are an adult navigating a profound challenge. Their role in the family has not changed. Principle number 4, the bridge of tools. Do use multiple communication modalities. Remember, language is more than just speech. Use gestures, pointing, writing, drawing, and photos. Keep a small whiteboard or a notepad handy. These aren't crutches. They are powerful bridges to understanding. However, don't pretend to understand. It's natural to want to avoid awkwardness, but feigning understanding when you haven't can lead to major frustrations and erode trust. It's far more respectful and effective to say, "I'm sorry, I'm trying my best, but I'm not quite getting it. Can you show me another way?" Honesty builds a stronger bridge than pretense. Learning to communicate effectively with aphasia is a journey. It requires patience, empathy, and practice. Remember, every small connection is a victory, and you do not have to walk this path alone. A speech-language pathologist, or SLP, is an invaluable resource. They can provide personalized strategies, therapy, and support for both the individual with aphasia and their family. For more information, visit trusted organizations like the National Aphasia Association or the American Speech Language Hearing Association. We will include links to these sources in the description below. Let us leave you with this final thought. Communication is not merely an exchange of words, but a sharing of presence. Your patience, your attention, your love. That is the most powerful language of all. Through this challenge, you have the opportunity to connect on a level you may have never known before. If you found this guide helpful, please give it a thumbs up. Subscribe to CareWise Seniors for more insights, and share it with a family who might benefit. Don't forget to hit that notification bell so you never miss our new videos. Thank you for joining us. Together we can foster stronger connections and deeper understanding in our families. The information provided in this video is for educational purposes only and is not a substitute for professional medical advice. Always consult with a qualified healthcare provider for any health concerns or before making any decisions related to your health or care.